like to welcome Dr. Kenneth Zaka to New Day Cleveland. And we had a couple moments to speak together, Doctor, just before this interview. And you seem like a guy who should be working with pediatrics. You've got a great sense of humor.
Oh, thank you so much. And sometimes, like everything, it gets you into trouble.
Well, you know what? Your whole business is getting people out of trouble, being a pediatric cardiologist. And we're going back to 1983 with a patient named Jessica Fletcher. And boy, you got her out of some trouble, didn't you?
Well, actually, the Cleveland Clinic got her out of trouble. So remember, I've only actually been taking care of her since 2014. But she's a Cleveland Clinic lifer, and I think the Cleveland Clinic really did a fabulous job of taking care of her over the last 38 years. And I think that the institution can be very proud. But really, Jessica and her family are the most proud for what she's accomplished over the last 38 years.
It started back when I was just a little bitty baby. Over the course of the years, there were 4 different open heart surgeries because of the heart condition that I was born with. It was very experimental procedures at the time, back in '83. And so we had to kind of change as my body changed and I grew up. So there was a lifetime process with the clinic.
Let's talk about that most complicated procedure that she had to undergo. It was almost experimental in those days, wasn't it?
When I first started practicing in the very early 80s, late 70s, all children with her type of heart defect died in the first week of life. And it was only in that very early time in the 80s when Dr. Bill Norwood, who was up in Boston at the time, devised an operation to try to help them. But it was an operation that was a very difficult one and only had a very limited success. And Jessica was one of the very first children in Cleveland to have this operation. And she was certainly one of the very first children in Cleveland to have the operation and to be successful and survive quite nicely.
She had a problem that involved the left side of the heart, correct?
Yeah, exactly. So she was born with actually, if you will, only half a heart. Ooh. The entire left side of the heart never really formed properly. And the left side of our heart is very important because it pumps the blood to our bodies.
So this is really interesting. And 35, 36 years later, you've given her, helped her have this great life. She's moved on to being a heart transplant recipient.
Not everyone with a Fontan operation, hypoplastic left heart, has transplant in their future, but it's certainly an important long-term risk.
My small 2-chambered heart finally said, I've had enough after 36 years. And they talked to us about transplant in the children's side of the hospital. And at first I was a little reluctant because I knew that it would mean a really long process. But through talking with family and spending time talking with my Heavenly Father, I came to the conclusion that this was something I needed to do because I knew that God was not done with me yet. To me, Dr. Zaka has been my right hand doc in helping me walk through this process.
To a lot of people, a lot of the patients, you're the miracle man. So that a lot of people to be thankful for your expertise, your help, and your wonderful, beautiful attitude and sense of humor.
Thank you. Well, you know, basically, I'm one of the people that specializes in adult congenital heart disease, which is that group of people like Jessica who were born with heart defects and then grew up to be adults. And I come from the world of pediatrics, and I've been fortunate to take care of many patients from birth well into their 30s and 40s. But really, I'm kind of a team captain in some ways, and I'm very fortunate to be associated with and surrounded by superb people who actually do all the work. I say, I think she needs this, and I've got somebody who does that. And so that's the great blessing of working at a place like the Cleveland Clinic.
Well, it's a wonderful thing for you, us, Jessica, and anyone who needs that kind of care. Hey, thank you very much for joining us on New Day Cleveland today.
My pleasure.